Good morning. My name's Sammy. I'm going to be your nurse today. How are you? Okay, let me just check your ID. What is your date of birth and your full name? Okay, Mrs. Smith. What I'm going to do is the doctor ordered a head-to-toe assessment. Is that okay if we do that? All right. And what that tells us is it's going to let us know how you're feeling as far as your body, the strength of your muscles, anything that may not be adequate or maybe abnormal that we need to take a look at. Good, okay? So we're going to go ahead and get started. So I'm just going to look and see what you have, what kind of therapy you're receiving. So I'm just looking at the area. Okay, so oxygen, good, over 98%. That's great. Tracheostomy, okay, looks good. And I'm just going to work my way down. And you got an indwelling catheter. All right, let's make sure there's no pressure on it. Good. And then you had surgery. Okay, so the wound, I'm just going to look at it. Okay. What is your pain level from 1 to 10? All right. We're going to go ahead and start with the vital signs. And that's going to include the your temperature. We're going to check the respiratory, your pulse. And we're also going to check the blood pressure. Okay. And throughout the assessment of the body part, you need to let me know if you feel any pain. All right. So where's most of your pain? Where is that? Where do you feel that? Okay, in your wound. Okay, we will go ahead and assess that last. Okay, so you're comfortable. And I will make sure that the lighting is good, so we're able to look at the body area. And also, are you comfortable? Okay. Okay. So first, let's take the temperature. And what I'm going to ask you, Mrs. Smith, have you had any surgical area in the facial, mouth area? Okay, can I just take a look and see? I'm looking for any lesions, anything that may look abnormal, that may not give me the adequate reading, so it looks good. So I'm going to do the oral temperature. And 98.7 is the normal temperature. Okay. And now I'm going to go ahead and do her respiratories. Respiratories are 16 to 20 are normal. And we count them for 1 full minute. Okay, and you're looking at the rise and fall of the chest, the exhale and inhale. Okay, so she's 18 respiratories per minute. I'm gonna go ahead and move on to the pulse. Okay, and the pulse, it could be taken in many different areas of the body. I'm gonna choose the radial. But that could be taken in the carotid, the brachial, the back of the knee, which is a popliteal, the back of the foot, which is the posterior tibia, and the top of the foot, which is the dorsus pedis. But I'm going to go ahead and do the wrist area, and I get my 2 fingers, place them on the thumb, and just run them up to the wrist. And we're going to do that for a full minute. Okay, the normal pulse, 60 to 80, and she's 75. So now I'm going to go ahead and do the blood pressure. So the blood pressure, we want to make sure that the artery part, that you're pointing the section of the blood pressure 1 inch above the artery. The cuff needs to be 1 inch above, and it has to fit nice and snugly and firm. And Mrs. Smith, let me know if you feel any pain or uncomfortable. Okay, you will feel a little pressure. Okay, so it's 1 inch above, and what we want to do is we want to pump the cuff 160 to 180, just depending on the blood pressure of the client. But what we want to do is listen to the artery first. And how we do that is I get my 2 fingers in the pinky side of the hand and just run them straight up to the brachial, and you should be able to feel it right there. Okay, and once you do is we pump the cuff until the sound disappears. That would be your systolic. When the sound reappears, that would be your diastolic. A normal blood pressure is 120 over 80. So we're going to go ahead and get started on here. When we pump the cuff and the sound disappears, we want to go 30 to 40 milliliters of mercury additional to that, and then release. So we're going to go ahead and listen to that artery. Okay. Okay, she's 115/65. Good. Okay, so now what we're going to do is we're going to go ahead and take a look and assess every body part, okay? We're going to go ahead and put some gloves because we're going to palpate and we might run into some discharge. Maybe some bleeding, hopefully not, but we're going to go ahead and palpate and we want to make sure we're protected here. So Mrs. Smith, I'm just going to look at the body part. I'm going to start with your head, okay? And what I'm doing is I'm just looking at to see if I see anything abnormal, any bumps that shouldn't be there. Just looking at the head area, I will palpate. When I palpate, I will look at my client's face for any pain expressions. Maybe there's a tenderness area, and by looking at her face, it'll let me know if she feels any pain or sore in that area. Are you okay? Okay, just let me know if you feel any pain. There's no bumps. There's no lesions. I'm looking to see if there's any lice. I'm feeling the hair. It shouldn't be oily or dry. Okay, that's good. So now I'm going to move to the ears because she has oxygen. I'm going to just take a look and see in the back of the ear, is there any tears? Is it moist back there? It should be dry and the skin should be intact. Okay, that looks good. I'm going to go ahead and look at her tracheostomy. Same thing. Looking to see if there's any moisture, any skin tears. Is there any abnormal discharge that I see? It shouldn't be there. Is it dry? And that looks good. And I would have her turn to the side to take a look at the back. Okay. The placement looks good. I will go ahead and check the inside of the ear now. I want to take a look and see if there's any bumps. Again, lesions. I'm looking for the serum. Is there adequate amount of serum in there? Is there too much that's maybe blocking her hearing? And because she's an adult, I'm going to pull the pinna up and back to strain the ear canal. Okay, and look a little further there. Looks good. I'm going to go ahead and look at her eyes now. Mrs. Smith, I'm just going to flash the light over your eyes. So I'm looking at the pupil to make sure they're bilaterally equal. They're accommodated to the light and reactive to the light. Okay, good. And they constrict well. The size of the pupil. I'm looking at the sclera. It should be white. It shouldn't be red. I'm looking at the eyelids, the top and the bottom. Are they swollen? Do I see any discharge in the eyes area? Both eyes. Okay. I'm going to go ahead and look at the nares. And in the nares, I'm looking up for the mucus. Does the mucus look moist? It shouldn't be dry. If it's dry, she needs liquid. She's dehydrated, so I want to make sure they're moist. Septum. What does the septum look like? Is there any lesions in there? Anything that may be abnormal? Looks good. Okay. And the oral, we looked at the oral, but I would be looking at a little more in the oral at the uvula. We'd be looking at that in the tonsils. Are they swollen? And I will have her say because that would help me also smell. Is she getting adequate oral care? Smell the odor. Does it smell like she needs a little bit more oral care? The tongue, the gums, are they intact? Is there any lesions there? Any bleeding? Okay. Okay, so that looks good. And now I'm going to go ahead and listen to the lungs. So I'll start in the front to do that. Let's see. I'm going to go and listen to your lungs, okay? And while we're listening to the lungs, we're listening for adventitious breath sounds. Do you hear any wheezing? She's having trouble breathing. Is there crackles, fluid in the lungs. So if you can take a deep breath and have her release. Okay, and I'll be doing the same thing to the other side. Okay, making sure they are bilaterally normal. Okay, good. Again. Okay. One more time. Okay, good. We're going ahead and listen to the back of the lungs, and Michelle's gonna, Mrs. Smith, she's gonna hold you, okay? There we go. Okay. All right, take a deep breath. Okay, again. Okay, again. Okay. All right, one more time. Okay. So we're done with that. And I'm going to go ahead and do the apical. So go ahead and listen to the heart. And the way we do that is we go ahead and run our fingers in the clavicle area, mid line of the clavicle. Okay, and then run the fingers down to the 5th or 6th intercostal space of the rib joint there. And it should be right in here, right below the nipple area. Okay, so we're going to go ahead and listen to the heart. And that what that gives us is the systolic, gives us the S1 and S2. The S1 is the closing of the valves of the mitral and tricuspid valves. And the S2 is the aortic and the pulmonic valves, the closure of those valves. Make sure they're functioning adequately. So I'm going to go ahead and do that. Run your fingers in the midline of the clavicle and then down to the 5th and 6th intercostal space of the rib joint and right underneath the nipple there. Okay, let's go ahead and listen to that. And the sound you should hear is lub-dub, lub-dub. That's the sound that you should hear when you auscultate that area. So I'm going to move on to the abdominal area. Okay, and the abdominal area, we want to make sure we auscultate before we palpate because we can cause the valves to become active, hyperactive. So we're going to divide it like in 4 quadrants. Okay, go. So I'm going to listen to the bell sounds. Make sure they're adequate. Okay. All right. They sound normal. And then I'm going to palpate. I'm just looking for feeling for any maybe bumps, abnormal bumps I may be feeling there. Does it feel firm? Is it soft? Does Mrs. Smith feel any tenderness in that area? Okay. Sounds good. And as far as the bowel sounds, you want to look at her stool. Is the stool firm, soft? Does it look like he has any bleeding in the stool? So we want to look at that. And now, Mrs. Smith, we're going to move to the bladder area. And here we're going to go ahead and again, we're just looking at the area. Okay, we're looking the whole time at the skin of every body part. Is the skin intact? We're just looking to make sure it's intact. Doesn't look like there's tenderness to the skin, red. So we're looking at that, and now I'm going to go ahead and now palpate that area. Okay. Just making sure if it's tender, feeling for if there's any abnormal bumps in that area. And she already urinated prior to the assessment because if she had to urinate, it would cause uncomfortable feeling for her. So it's okay. The skin is it's not dry, it's warm. You don't want it to be hot because that's sometimes a sign of infection. Okay, good. That's good. Okay, good. And then the indwelling catheter, We're just kind of looking at the exterior part of it, make sure there is no abnormal discharge in that area. Is there any redness? The skin again intact? Any lesions due to the catheter? She looks good. Okay. In the urine, we would look at the urine. Is it extremely clear? It means too much water. She's taking in too much water. Is it yellow, which is normal? If it's pink, it means there's blood in the urine. So we would be assessing that as well. So we're going to go ahead and do the capillary refill. This will check the circulation of blood flow, make sure it's adequate. And what we do is we press onto the nail bed, and it should blanching should go away within 3 seconds. All right, it's good. And now, Mrs. Smith, we're going to check for the tinting of the skin. We're going to pull the skin slightly, and that'll let us know if she's dehydrated or not. The tinting can be done on the forehead, the chest, or the back of the hand. I'm going to use the back of the hand. And we just pull the skin slightly and wait for the skin to recoil back, and it should do it within 3 seconds. Okay, that's good. And again, I would do the same thing as far as the assessment of the capillary on the other side as well. Okay, everything bilaterally should be equal. And now I'm just gonna uncover. I'm gonna go ahead and look at your extremities, okay, Mrs. Smith? So I'm gonna do one, and again, bilaterally, I'll be doing the other leg as well. Okay, so I'm just looking at the skin again throughout the whole assessment for intact, and make sure that the skin feels warm, not hot, not cool. It feels good. It's okay, all right. Okay, her feet look good. Okay, so what I'm going to do now over here is I'm just going to go ahead and I'm going to go ahead and do range of motion. We're going to go ahead and do, just check the strength, okay, and move your joints, the body parts, make sure you're able to do that, okay, with no pain. So let me know if you feel pain. So just squeeze my hand. Okay, good. Can you push it back? And about forward. Okay, good. And I'd be doing the same thing to the other side. Now we're going to go ahead and just do a flex and extend. Okay, good. And we do it 3 times. And the hand, if you can just go ahead and move it around in a circular fashion, okay? Good. And I'm just going to flex your fingers and extend. Okay. Right. And just let me just go back to the neck area. Can you turn it to the left and to the right? Okay, good. And we're going to move down to the extremities. Okay. All right. So on here, I just want to make sure that you're able to flex and extend the foot. Okay. So you're going to go ahead and flex and extend. Good. Okay, and your toes. Flex and extend. Good. And then your knee. Flex, extend. Good. And I want to go ahead and just check the hips. Okay, so I'm going to go ahead and do the abduction, adduction. So abduction, adduction. Good, no pain. Okay. And then the hip. So we just push it. All right, okay. Good. We would do it 3 times each body part. Okay. One thing I do want to do is Holman sign. We want to check for that. And that is if she feels pain in back of the knee. So I would run a blunt object up her foot, and if she would feel any pain in the back of the calf, then I would be a positive sign, a Holman sign, okay? So that's done. So for Mrs. Smith, okay, good. And then last, what I would do is assess her wound. And that'd be the last thing. We're gonna go ahead and assess the wound now, okay? And when I'm looking at the wound, I already looked at it at the beginning, but now I'm really gonna take a closer look at it. And what I'm looking at is make sure that, make sure there's no flank bleeding in the wound area. I'm actually smelling to see if there's any odor of infection, sign of infection in that area. What does it look like? Does it look like it has any discharge? Does it look tender, red around the area? Okay, looks good. And then I'm palpating it around the, just around the area where the incision is, just to see, do you feel any pain, any tenderness? Oh, okay. All right, I'm also feeling the skin. Is it hot? And that's also a sign of infection. Okay, it's warm. Good. Okay. Great. Okay, Mrs. Smith is doing good.